Hello everyone, my name is Lucy Anderson Miller and welcome to my case review. After looking through all the different cases throughout our textbook, I've decided to talk about Case 9, which focuses on Major Depressive Disorder, or MDD. To begin this case review, I wanted to give a definition of Major Depressive Disorder. According to our textbook, Casebook in Abnormal Psychology by Timothy Brown, in DSM-5, a major depressive episode is defined by the following two features, one or both of which must be present for at least 2 weeks. A is a depressed mood most of the day, nearly every day, as indicated by either the person's report or observation by others. And B is a marked decrease in interest or pleasure in all or almost all activities. For example, hobbies, social activities, or work. In addition, a major depressive episode is characterized by at least 4 of the following symptoms. A is a significant weight loss or weight gain, or persistent decrease or increase in appetite. B is insomnia or sleeping more than usual. C is agitation or slowing of body movement, for example, the inability to sit still or slowed speech. D is fatigue or loss of energy. E is feelings of worthlessness or excessive or inappropriate guilt. F is lessened ability to think or concentrate or difficulties making decisions. And G is recurring thoughts of death or suicidal thoughts, plans, or attempts. Now to get to the case, the individual discussed throughout this case is that of Leona Barraco, who is a 13-year-old Hispanic girl in the 7th grade. Leona attended a private school for about 2 years, where she mentioned to one of her friends that she had thought about committing suicide. After going to meet with a school psychologist, Leona's mother thought it would be best to make an appointment at the psychology clinic. Leona suffered from many of the symptoms I stated earlier. She reported in her evaluation session that she was feeling depressed, having more suicidal thoughts that scared her, had become more irritable, lost motivation to see her friends and participate with her swimming team at school, lost her appetite, and had difficulty sleeping, all of which are signs of major depressive disorder. Depression, while not only showing symptoms in an individual's daily life, can also have effects on their physical health. According to the CDC, mental illness, especially depression, increases the risk for many types of physical health problems, particularly long-lasting conditions like stroke, type 2 diabetes, and heart disease. Similarly, the presence of chronic conditions can increase the risk for mental illness. Going along with that, Leona also suffered from physical symptoms, some of which included headaches, feeling detached from her body, her grades dropping over the past 3 months, and getting into more conflicts not only with her parents and 2 younger sisters, but also with her friends at school. As we all know, there are many things that can trigger depression, and in the case of Leona, there were many. Leona's family did not have a lot of money and had large amounts of family struggles. Her parents divorced when she was a toddler, which resulted in her father moving in and out of the house she lived in with her mother and 2 younger sisters. Along with that, Leona switched schools because of a scholarship she received to an upper-class private school. This was a big change for Leona, as she was now part of a very few minority students at this new school. According to our textbook, stressful life events produce major depression because these life events activate our stress hormones, which, in turn, have wide-ranging effects on our neurotransmitter systems, particularly those involving serotonin and norepinephrine. If these stress hormones remain activated, structural and chemical changes in the brain may occur. For example, the atrophy of neurons in the areas of the brain that contribute to the regulation of emotions and neurotransmitter activity. As if these changes were not stressful enough, Leona also has had many family members who suffered from psychological disorders, such as depression and alcoholism, to name a few. To switch gears, I will now be answering to the best of my ability the thinking critically questions that are asked at the end of the chapter. The first question states, major depressive disorder has been linked to many causes, including biological and genetic, cognitive, behavioral, and social and interpersonal factors. Which factors do you believe are the most important to the development of major depressive disorder, or MDD? How does having MDD affect a person's thoughts, behaviors, and social interactions? What effects can MDD have on how family and friends interact with a depressed person? And finally, how can these interpersonal changes result in the maintenance or exacerbation of depression in the afflicted individual? To answer this question, there are many things that can contribute to major depressive disorder. Some of these contributing factors include stressful life events, trauma, a lack of support, history of depression in the family, and the loss of a loved one, to name a few. As we learned from Leona's case, having major depressive disorder can have a great effect on a person's thoughts, behaviors, and social interactions. Having this disorder can drive an individual to isolate themselves, which reflects negatively on their relationships, job or school duties, and their thoughts. Not only can this disorder drive someone to isolation, but can also, as seen in Leona's case, make them more irritable and lose motivation to do just about anything. As for the effects that major depressive disorder can have on how family and friends interact with the depressed person, there are many. As I just talked about, MDD can drive an individual to isolation, and that can be not only a hindrance to the individual, but also to their family. This can result in family distress, aggression, and guilt. Having supportive family and friends is crucial when it comes to the maintenance of a depressed individual. Leona struggled with this. Her parents were constantly fighting, sometimes even taking it out on Leona, and her sisters were younger than her, which made it harder for them to understand and for her to talk to them. Along with that, individuals who are depressed can have a hard time seeing themselves as not a burden to their friends and family. Having a lack of support and feeling like a burden can make it very difficult for a depressed individual to ask for or receive help. Question number 2 states that prior to the DSM-5, it was possible to assign both MDD and dysthymic disorder, also known as persistent depressive disorder or PDD, when the features of both conditions were present. These cases of double depression are subsumed under the new diagnostic category, persistent depressive disorder, in DSM-5. What do you think about this change in the diagnostic system? Do you think it would be clinically important to diagnose both if the features of MDD and dysthymic disorder are present? Or do you think the PDD diagnosis is more parsimonious and does not result in the loss of important clinical information? What do you think about the decision to assume chronic MDD under the PDD diagnosis? This question was a little bit confusing to me. From my understanding, MDD and PDD are very similar. One major difference between them is that PDD is persistent and lasts for about 2 years, whereas MDD symptoms are separated by at least 2 months. According to the National Library of Medicine, it is generally viewed as capturing a scenario whereby an individual experiencing dysthymia has his or her condition worsen from time to time, and leading in such instances to the development of MDD being superimposed, so that the term double depression presupposes 2 extant conditions. To simplify this, MDD and PDD are very similar, but the causes and symptoms can be different. When looking at the bigger picture and determining whether or not the PDD diagnosis is more parsimonious, I would have to say that I think it is important to include both MDD and PDD as separate disorders. Although they are very similar, I think that there are enough distinguishing factors between the two for them to be separate disorders. Question number 3 states, in addition to the psychological intervention described in the treatment of Leona, medications are another widely used method of MDD treatment in children, adolescents, and adults. What do you believe are the major issues and considerations in using drugs in the treatment of children and adolescents? To answer this question, there are many things to take into account when considering a child or adolescent for drug treatment, such as risk factors, environment, and behavioral and emotional factors. Using drugs in the treatment of children and adolescents can open up a whole new world for these children to abuse drugs. According to JAMA Pediatrics, the younger a child initiates alcohol and other drug use, the higher the risk for serious health consequences and adult substance abuse. Along with that, also according to JAMA Pediatrics, inadvertent passive drug exposure in infants and toddlers has resulted in multiple medical complications, including respiratory illnesses, seizures, altered mental status, and death. With that being said, I believe that drug treatment should be a last resort when it comes to major depressive disorder in children and adolescents. Finally, question number 4 states that surveys have found that the prevalence of MDD and other emotional disorders was highest in persons between the ages of 15 and 24. What factors do you believe account for the higher rate of disorders in this age group? To answer question number 4, I believe that there are many factors that can contribute to the prevalence of major depressive disorder and other emotional disorders for those around 15 to 24 years old. The first one is the anxiety and stress individuals around this age experience. In between this time frame, individuals are either in high school or college, both of which are extremely stressful times in their lives. Along with that, this age group is greatly influenced by social media and the concept that everyone's life is perfect. So when their life is not going well, they may feel that they cannot talk about it without getting backlash. To continue, I will be talking about what I found to be the most interesting throughout this case. What I found to be the most interesting in the case of Leona's major depressive disorder was the conceptualization of Leona's depression. It is stated in the textbook that Leona's depression was conceptualized as being related to an interpersonal role dispute with her mother and her father. An interpersonal role dispute is defined as disagreements between the patient and one or more significant others about the expectations about their relationship. One example of this is parental expectations that the adolescent should function at a level of maturity higher than he or she is capable of achieving. Leona was often switching back and forth between two roles in her family. She was either the 13-year-old daughter or her mother's companion and protector from her father. The textbook stated that Leona was a parentified child, not only because of the single-parent situation, but also because she appeared much older than her 13 years in her dress, her intelligence, and her manner with adults. When her father came back into their lives, however, Leona would get very defensive and protective of her mother. This was interesting to me because I have seen this kind of relationship in my family and found it helpful to see an example of it in another case. As far as treatment options go for Leona, I would suggest a treatment that focuses on her issues with her parents. This is a tension that has been weighing heavy on Leona, and figuring out how to cope and maybe solve this problem could be a very big step in helping Leona through her major depressive episode. In fact, this treatment style was actually used in the case of Leona. Leona and the therapist focused greatly on the roles and communication between Leona and her mother. After the conversation with the therapist, Leona talked to her mother and later reported that she felt much closer to and better understood by her mother, and she identified it as a turning point in the treatment. Her mother's support and responsiveness to the treatment principles were also instrumental in Leona's success with therapy. With all that being said, that concludes my case review. Thank you for watching, and I hope you learned a little bit more about major depressive disorder.